at the point that we admit people, we're considering how we discharge people. Recognising that it can take longer for some than others, we're always looking at a least restrictive approach. A high secure hospital can be very restrictive. To get to a high secure hospital, there have been lots of challenges for an individual. That journey is very much about working in partnership with individuals at their pace. So we don't have a menu that we go through with every patient who comes to us. We do an individualised assessment. We develop relationships that we hope will be effective and beneficial to the patient. But it's always, our progress is always going to be at the patient's pace, and it has to be alongside the patient as opposed to doing to the patient. And that's our ethos. That's what we aim for.
When they arrive at the hospital, they will go through a process where they're admitted into the hospital and taken onto the ward area. Once on the ward area, the staff will, again, depending on the circumstances, because people come in great distress, other people are a little bit quiet and a bit subdued when they come in. So we have to judge it on an individual basis as to how we approach somebody. It will be a case of sitting down, having a cup of tea, explain what the ward is about, and try and reassure people that it's not the place they're worried about coming to. It's a good place for them to get well. And once they're on the ward, once they've spent time on the ward, they will meet the other patients, they will see their bedroom area, and they will get to know what the hospital environment's all about.
We're in a patient's room at the moment, which is an individual room with an ensuite. Patients have full access to the room at all times, which they can personalise with all their own belongings, pictures on walls. All rooms have a television, which has all channels. At night time, patients are confined to their individual room, but at the rest of the time, there's fluid access in and out throughout the day. In the room, patients have the opportunity to clean the room, so it's of a standard that they would like, so they have the access to cleaning materials to do that on a weekend or other times during the week. This is the dining room here on male mental health ward. We have breakfast at 8:30, dinner time around 12:30 and tea time at 5 p.m. All sit down together in this area. Something that we often do, in particular at dinner time, is we'll put the radio on, so it makes it quite a sociable start to the day. The choice in the menu is very good and explanatory in terms of vegetarian, high, low sugar fats, and even pictures of what the choices are. It's the main day room on the ward. It's used for all sorts of activities, watching television. There'll be sort of groups of patients watching particular football matches, or at the weekends, things like Strictly, The Voice and things are quite popular, and everyone will get involved with that. During the day, patients might be off the ward and other patients on the ward, so it can be quieter in here, which other patients will like. All the patients, whole ward and staff, will go to the hospital library once a week. All patients will individually get books out and CDs, and can also request things that they'll order to come at a later date. Alford Ward's got a set timetable similar to all wards. It will go to the shop once a week, to the hospital library once a week. Alford also go to a couple of the daycare areas over at the Southall unit, Ashby unit, the sports hall twice a week, as well as going outside. There'll be things at least 1 or 2 every day of a ward programme, but an individual patient will also go off to specific daycare areas, such as education or maybe some of the workshops. Occupational therapy will come to the ward and do 1 or 2 sessions per week, and then there'll be individual therapy sessions with psychologists, and that's specific to an individual patient's care programme and their sort of therapeutic need.
Every patient has their own multidisciplinary team, and quite often those will be linked to the ward. That will class as a medical person who will be the responsible clinician. Every patient will have their own responsible clinician. They will all have their own named nurse for the ward, and there will be other people involved, including psychology, occupational therapy, speech and language therapy, and whatever else that person needs. There'll also be a social worker for each patient who will have a key responsibility in linking in with the family and carers and making sure that they're involved and engaged. Every single week there is a ward round for each ward. They will discuss all of the patients in a small amount of detail, and then some patients will be discussed in greater detail. So there'll be 3 or 4 patients each week that will go into the ward round, have more of a discussion about where they are and what's happening with them. And that may be the small discussions about what they can and can't have access to within their own bedrooms if they're improving, or it may be larger discussions about when they're leaving the hospital or what treatment pathway they go on.
So every patient that's admitted into the hospital, speech and language therapy will see those patients and undertake an assessment of their speech, language and communication skills. We assess their language abilities, so we're looking at their strengths and also areas of need that we can then inform the clinical teams of how they might need to support that patient in their treatment pathway.
So the vast majority of consultants really would see the patients, the first day or two of them being here, and would certainly make a point of seeing the patients each week with the team, particularly in those early stages to see how things are going. But I think from the responsible clinician point of view, quite often we see patients in what we would call a sort of ward round setting, so a multidisciplinary team meeting. I would certainly hope that we were able to involve them in a really meaningful discussion about what their needs are, what their fears are and their hopes are, and equally being clear from our point of view of the things that we need to be clear about in terms of moving them forward, really.
What we know is we have a range of clinicians who are skilled in assessing the needs of individuals, but there's nothing more powerful than the knowledge of an individual before they became unwell, or before they went into prison, or before they went into secure care, and particularly before they came to Rampton. So the critical relationships that carers have with our patients, and that also patients, relatives, friends will have, is really important for us to be able to include that in our assessment and our ongoing treatment and review of the patient, so that we know that their previous experience informs what led them to be with us, and there's a really useful relationship that can be developed between a multidisciplinary team and carers to assess how somebody's progressing.
Social workers have contact with the patients prior to them coming to the hospital. We undertake a full pre-assessment report. We go to see the patient quite often. We try, where we have permission, to contact the patient's relatives to receive their views about them coming into hospital. We act as an important link between them and the patient's clinical team, helping them to understand and feel involved in the work that we do, and also keeping them up to date with the patient's progress.
So a named nurse will be a qualified nurse, a registered nurse, who will have a mental health qualification. The first thing that most named nurses will need to do is develop hopefully a trusting relationship with their patient, and that's based on being honest and spending time with them. After that, you are looking to help coordinate their care from a nursing perspective, whilst incorporating the wider clinical team's input as well.
As part of the admission process, a patient is allocated an occupational therapist who is the link for the patient within the assessment unit. And their journey in here is the start of the pathway through therapy and education, and not just occupational therapy, but also speech and language therapy. We're looking at engaging patients in meaningful activity, but whilst doing so, we're actually looking at assessing and managing risk, looking at improving such things as self-esteem and self-confidence, the motivation to engage, and actually giving them a realistic daily pattern of meaningful occupation. The assessment unit is really just a starting point for the patients, for them to move on into other areas of therapy and education, using a range of skills, activities and tools. So we do have a tool assessment process as well, which looks at assessing the patient's safety whilst using tools such as woodworking tools, things in the kitchen, everyday items.
This assessment provides us information in terms of what tools a patient is able to and safe to use within different areas. The occupational therapist will then provide a referral to vocational services where a patient has an interest in learning real-life work skills or perhaps developing new skills they can use for future rehabilitation, be that in either woodworking, gardening, or it could be some sort of trade skill element or within computer design such as graphics. So the link with the care programme approach is that it enables patients to safely take risks in a supported environment and to explore their interests and hopefully to develop real life skills, and also to enable them the opportunity to gain qualifications which they can use in the future, which obviously overall helps to reduce their clinical risks and looks at rehabilitation to help them move towards their patient pathway.
We have a range of subjects that we offer to the patients. Our focus is mainly on the functional skills of literacy, numeracy, and becoming computer literate. And we offer discrete sessions so they can come in and learn that, especially at various levels. And then we offer the opportunity for them to apply those skills or learn those skills when they're embedded into something like cookery. All patients are encouraged to leave here with a certificate or a qualification.
So our service provides a form of psychotherapy which uses creative mediums, whether that's art or music. The aim is very much to work with the patient to explore either their sense of identity or very clearly defined treatment aims that we work in collaboration with the multidisciplinary team to identify. Obviously, because we're a psychotherapy team, we're looking for very clear clinical aims. We will gear the therapy, it becomes bespoke to that individual or to that group. Some of it may be purely about helping patients to understand how they relate to themselves and others.
So we address physical health and their general well-being. The team firmly believe that a healthy body can help support a healthy mind, and we use the fantastic facilities we've got here at Rampton Hospital to do that. We work with the occupational therapists to grade activities and to help the patients with their recovery. We have a healthy lifestyles team which initially meet the patient. They perform a physical health assessment and can prescribe exercise and exercise care plan. From that stage, we find out the patient's interests and put them into appropriate activities. It can build teams and communication, and as people know, sport is fantastic at building self-esteem. The technical instructors feed back to occupational therapists in the form of CPA reports and general feedback meetings as well. As in, the patients have been on the ward all day, they can come down here and play an activity they want to do, whether it be football, tennis, or in the fitness suite, or go for a swim. The benefits are there that exercise shows it can help reduce depression. We have a 16-week weight management program with a healthy lifestyles team, which deliver clinical assessment, but also educating patients on how to eat more healthily. Each directorate has its own outdoor or weather pitch, which we play football on. In the summertime, we go out for walks. We play cricket and also do a new boot camp activity as well, which has been very popular.
The physical health centre in Rampton Hospital, this is where we look after basically the physical health of any patients. We offer them the same appointments and reviews that they would get in the community normally. Dental appointments, opticians, podiatry, GP services provided. We've also got nurse clinics that we run as well for chronic disease management, anything like that. Anybody can refer a patient to the health centre, the Rampton Health Centre, maybe a staff or an OT, or even the patients themselves if they feel unwell or if they need something checking. A pharmacy, we liaise with them for any medications, any treatments, we try and keep them up to date. We're currently running a patient who requires dialysis 3 times a week, Monday, Wednesday, Friday, so that's done on site as well. So basically we cover whatever needs to be covered physical health-wise.
On admission to the hospital, a patient would be visited by a chaplain and would coordinate that with staff on the ward. And depending on what particular faith they are or religion, we'd go and see them, have a chat with them, and make sure that the relevant chaplain then came to see them.
From there, we'll help them to access the various activities and services that exist. Throughout that time, as part of the multidisciplinary team, we'll attend key meetings and support them throughout that.
Then we also have group discussions as well. So we have Bible studies, we have an Islamic discussion group as well for Muslim patients. So some of the groups are actually tailored to the need of the patient and their religious and faith requirements.
Zest is the patient shop, which is like a mini supermarket. All of our patients have access to it on a weekly basis, and that is on a rotated schedule. They have approximately 40-45 minutes per visit. We sell snacks and gifts, toiletries, CDs. So we try to cater a bit for everybody, all our male and female patients. We focus on healthy items, so all of our items are what we call RAG rated, RAG standing for red, amber or green. We encourage our patients to focus and buy more on the healthy, the green or the amber items, and that allows them to make healthy choices. Togs is a clothing shop for, again, all of our patients. Patients visit quarterly. Patients took part in a survey before the shop opened, and quarterly was the frequency that they deemed most necessary to visit the shop and buy clothing. They can have a look around, they can try stuff on. The staff who are in here can help them find their correct sizes and advise them what suits them. And so far it's just been received so much positive feedback.
The aim of the hospital is ultimately to provide a safe environment where patients can improve to the point where they no longer need to be in the hospital. However, we do appreciate that people don't necessarily always get to where they want to be in terms of their treatment, so they may be here a long time. So the aim is to make it an environment that people can thrive in and that people feel happy in, as well as feeling safe and secure. We want it to have very much a recovery focus, so that the intention is for people to be supported to move on in their own way. The ethos is that each person's care has to be different for that individual, but it has to be with an ultimate aim of getting them as well as they can be and as happy as they can be.